ನಮಸ್ಕಾರ ಎಲ್ಲರಿಗೂ. ನಾನು ಡಾಕ್ಟರ್ ಸುನಿಲ್ ಆ್ಯಂಡ್ ನನ್ನ ಜೊತೆ ಡಾಕ್ಟರ್ ಮನೀಷಾ ಇವತ್ತು ಇಲ್ಲಿದ್ದಾರೆ. ನಾವಿಬ್ರು ಜಯದೇವ ಮೆಮೋರಿಯಲ್ ರಾಷ್ಟ್ರೋತ್ಥಾನ ಹಾಸ್ಪಿಟಲು RR ನಗರದಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತೇವೆ. ವಿ ಆರ್ ಪಾರ್ಟ್ ಆಫ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ Gastro-sciences and General Surgery. In our department, we take care of all the problems related to your stomach, your intestine, your colon. ಅದಲ್ಲದೆ ನಾವು ನಿಮ್ಗೇನಾದರೂ ಲಿವರ್ ಪ್ರಾಬ್ಲಮ್ ಇದ್ದರೆ, ನಿಮ್ಮ ಪಿತ್ತನಾಳದಲ್ಲಿ ಏನಾದರೂ ಪ್ರಾಬ್ಲಮ್ ಇದ್ದರೆ, ಅನ್ನನಾಳದಲ್ಲಿ ಏನಾದರೂ ಪ್ರಾಬ್ಲಮ್ ಇದ್ದರೆ ಅದಕ್ಕೆ ಉಪಚಾರನೂ ಮಾಡ್ತೀವಿ. ನಾವು ಈ ಡಿಪಾರ್ಟ್ಮೆಂಟಲ್ಲಿ 3 ಜನ ಇದ್ದೀವಿ. ನಮ್ಮ ಜೊತೆಗೆ ಡಾಕ್ಟರ್ ಸಾಗರ್, ಮೆಡಿಕಲ್ ಗ್ಯಾಸ್ಟ್ರಾಂಟಾಲಜಿಸ್ಟ್ ಅವರು ಇದ್ದಾರೆ. ಅವರು ಎಂಡೋಸ್ಕೋಪಿ, ಕೊಲೊನೋಸ್ಕೋಪಿ ಮತ್ತು ಯಾವುದೇ ಥರ ಪ್ರೊಸೀಜರ್ ಥ್ರೂ ಎಂಡೋಸ್ಕೋಪಿ ಆ್ಯಂಡ್ ಕೊಲೊನೋಸ್ಕೋಪಿ ಬೇಕಾದರೆ ಅದನ್ನು ಮಾಡ್ತಾರೆ. ಇದಲ್ಲದೆ ನಮ್ಮ ಹತ್ರ 24/7 ICU ಫೆಸಿಲಿಟಿ ಇದೆ. ನಿಮಗೆ ಉದರಕ್ಕೆ ತಕ್ಕಂತೆ ಯಾವುದೇ ಎಮರ್ಜೆನ್ಸಿ ಪ್ರಾಬ್ಲಮ್ ಇದ್ದರೆ ನೀವು ಆಸ್ಪತ್ರೆಗೆ ಯಾವಾಗ ಬಂದ್ರೂ ನಿಮಗೆ ಚೆನ್ನಾಗಿ ಏನು ಆರೈಕೆ ಬೇಕು ಅದನ್ನು ನಾವು ಕೊಡ್ಲಿಕ್ಕೆ ಸಾಧ್ಯವಾಗುತ್ತೆ. ಸೊ ಇವತ್ತಿನ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಡಾಕ್ಟರ್ ಮನೀಷಾ ಅವರು ಒಂದು ತುಂಬ ಕಾಮನ್ ಆಗಿರುವ ಪ್ರಾಬ್ಲಮ್ಮು ತುಂಬ ಜನರಿಗೆ ಹರ್ನಿಯಾ, ಈ ಬಗ್ಗೆ ನಿಮಗೆ ಒಂದು ಕಿರುಪರಿಚಯ ಮಾಡಿಕೊಡ್ತಾರೆ. ಈಗ ನಮ್ಮ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಹರ್ನಿಯಾ ಕ್ಯಾಂಪ್ ನಡೀತಾ ಇದೆ. ಪ್ರತಿ ವಾರ ಶುಕ್ರವಾರದಂದು ಶನಿವಾರದಂತೆ ದಿನ ನಾವು ಕ್ಯಾಂಪ್ ಮಾಡ್ತೇವೆ. ಸೊ ನಿಮಗೆ ಡಿಸ್ಕೌಂಟಲ್ಲಿ ಇನ್ವೆಸ್ಟಿಗೇಷನ್ಸು ಅದೇ ಥರ ಆಪರೇಷನ್ ಅವಶ್ಯಕತೆ ಇದ್ದರೆ ಅದನ್ನು ನಾವು ಡಿಸ್ಕೌಂಟಲ್ಲಿ ಮಾಡಿಕೊಡ್ತೇವೆ. ಸೊ ಐ ರಿಕ್ವೆಸ್ಟ್ ಡಾಕ್ಟರ್ ಮನೀಷಾ, who is my colleague and who is also a gastro surgeon, to discuss about hernia, which is a very common problem, in brief with all of you. Over to you, Manisha.
Thank you, sir. Hello everyone, good afternoon. This is Dr. Manisha and I'm consultant in Department of Surgical Gastro and General Surgery, Jayadeva Memorial, Rashtrottana Hospital, RR Nagar, Bangalore. Today, as sir mentioned, I will be talking on hernia, briefly more on inguinal hernia because it is very common in our population and we need to know its significance and when do you anticipate complications and who are the group of people who need actual surgery and surgical management for this condition. Okay, so coming to inguinal hernia, what exactly is inguinal hernia? It is nothing but it is an abnormal protrusion of a viscus. Viscus in a sense, intestine or an organ or part of the organ into a abnormal opening through a sac covering it. So this is a scientific definition of hernia. To commonly tell what hernia is, so basically there is defect in the abdominal wall muscle and with that defect some internal organs are coming out and they are covered with skin and the thinned out layers of the abdomen. So this is hernia in common. Why is it very common? So basically the significance of hernia lies with the fact that 15% prevalence is present worldwide. So basically in if you take 100 people as a population, so around 13 to 15 males usually end up having hernia. Most of them wouldn't be aware that they have hernia and a couple of few people would know that they have a hernia because it would have quite a significant size. Okay, so now what are the causes of hernia? See, to tell about hernia, it is very common in males, be it any race, be it any ethnicity. It is very common in males. Not that common in females, but yes, umbilical hernia, incisional hernia and other parts of hernia is common in females, but inguinal hernia is more common in males. So what are the causes? The first cause here comes congenital. When something is this common, that means there should be some congenital defect. So that is the first common cause is congenital. That is, since birth there is a problem, there is a defect and hence a child is developing hernia. The other causes are weakness of abdominal wall, usually seen in obese patients, liver disease patients, renal kidney disease patients, and all these patients, they have weak abdominal wall. So these patients end up having adulthood hernia. It is more common during pregnancy also. One is because of the heavy fetus pressing on the pelvis and 2 because of progesterone and 3 smoking predisposes to hernia. Yes, smoking is one very important cause for hernia because that leads to weakening of the collagen in the body, that leads to weakening of the muscles and other tissues in the body, causing weakness of abdominal wall and hernia. So these are quite common causes of hernia. Okay, now what are the types of hernia? So one is a congenital type where a person is having since birth, and one is the adulthood type, that is the acquired cause. By congenitally it is common. So basically when a male child is developing in the mother's womb, the testis is part of his abdomen, it is not in the scrotum. It comes to the scrotum at the time of birth or partly after birth. So this is the common physiology of testis descent. We call it as descent of testis. It starts from the level above the umbilicus, and in 9 months of pregnancy it reaches down to the bottom of the scrotum, and then it is placed in the normal structure, that is scrotum. So in this movement what happens is there is a small weakness at the level of the inguinal region, that is at the level of your groin, where the upper part of the abdomen is reaching the scrotum. So in this point there is a small opening from where the testis is coming into the scrotum. So this small opening closes exactly at the time of birth. So in most of the males there may be a problem in the closure of this defect. So basically hernia is not like something very major problem that you have ended up in. It is just part of your normal physiology where the closure wouldn't have happened properly, and hence you may end up leading with hernia. Okay, so this is one thing. And hernia can present in childhood, that is the child born immediately or within less than a year, or it can be presented in the early adulthood like in the age of 20-25, or it can be presented in the old age patients. Now all three presentations are different. Okay, in young children, what happens in young children is there is a scrotal swelling. The swelling increases and decreases when the child tries to cry, when the child tries to stand. This is purely congenital hernia. And what are the possible complications is the testis has to be brought back into the sac, the scrotal sac, and it has to be fixed. The hernia should be fixed in children as soon as it has been diagnosed. As soon as the child is a year old, the hernia should be addressed in a newborn child in case he has a hernia. Early adulthood patients. So some children don't show up hernia in early age group. Later on, when they reach 15 years, 20, 25 years, hernia comes up. So basically a young guy complains of his half of the scrotum, which is called hemiscrotum, either right of the scrotum or left part of the scrotum is more swollen and increases in size while he's walking or doing some strenuous activity. Okay, and what about the adulthood, old age? Hernia is again common in old age. It is bimodal, either it is common in very young age or it is common in old age, not in the middle age. Now old age cause is very different. Old age, the testis has come down properly, the closure that brings the testis down has closed properly, everything is normal. But in old age patients, because of aging process, as I told, because of smoking, because of other causes, the abdominal wall becomes weak and henceforth it causes to hernia formation. So these are the three types of hernia you see: very young age and old age. Very uncommon to have hernia in the middle age, or maybe a young guy who's not shown any doctor would have hernia in his middle age. Okay, so now how can a patient present to you? See, you may be absolutely symptomless. Now in 15 people in 100 people can have hernia. Not all 15 come to the hospital because they never realize the hernia. Most of the males don't realize that they have hernia. It seems like it is just a mild scrotal swelling. Okay, what is the other presentation? Other presentation is a swelling that comes and goes. When the person is standing or running or something, the swelling comes and the swelling goes back. This is a safe window period where the hernia is not complicated. Okay, and the next symptom is the patient can have dull aching pain in the scrotum, which happens on long standing. When you leave the hernia for a year, 2 years, 3 years, this is a very common complication you develop, a dull aching pain in the scrotum. What else can happen? Now till here everything is okay, till here everything is manageable. The next step is when the hernia gets complicated. This is when it becomes an emergency situation where you need to take the surgical help or a doctor's help. So what are these complications? The hernia which was coming and going back will stop coming and going back. It is fixed in the scrotum. It becomes very painful. It becomes tense. Tense in a sense very hard like mass. or there can be severe pain abdomen associated with vomiting, which indicates that the hernia has gone into complications such as intestinal obstruction, where your intestines have come into the scrotum bag and it is sitting there and it is not going back. So this is a very dreaded complication and it needs emergency visit to the hospital, and probably emergency surgery has to be taken up for the correction. Now, what kind of surgeries you can do for hernia? See, usually in children and in the young guys, there has to be correction of this hernia. Why? Because the testis normal area is to be in the scrotum. In case it is not there in the scrotum, the children and the young adults may have some fertility issues too. It can end up into complications. So, infants, children and young adults should invariably undergo hernia repair, whether or not they have complications, whether or not they have pain. Okay. And coming to the old age people. Now, in old age people, hernia we see in case the patient is uncomplicated, in case the hernia is pretty small, in case the hernia is reducible, that is easily going back, the patient is asymptomatic, then we can push the surgery ahead. And accordingly, if the patient is having some cardiac diseases, if is unfit for surgery, you can postpone the surgery, or you can say no to surgery and just properly vigilantly see the patient, see if he develops any symptoms. Otherwise, adulthood hernia in some cases can be left alone, but under proper surveillance and proper follow-up. Okay. So what is the treatment modality of hernia? There are so many things that come up. Taking this medication can reduce hernia, wearing a belt can reduce hernia. No. There is no such treatment for hernia. Hernia is the only surgically correctable disease. The only treatment for hernia is surgery, surgery and surgery alone. So what do you do in this surgery? In children, nothing. There is a small defect which you close and you cover the skin. That's all. The hernia is repaired. It is a very minor procedure, just like a hydrocele surgery. In children, it is very easy. Anybody else other than children, early adulthood, adults and geriatric group, we have to put a mesh. Basically, the hernia is formed because there is a small defect, there is weakness of the abdominal wall, so we need to put a mesh. What exactly is a mesh? A mesh basically looks like a mosquito net, but it is a medical quality mesh. It is a medical quality mosquito net which is sterile, which is of high quality proline. So this mesh is put, the hernia contents are reduced, and then the hernia is repaired surgically. So there is only surgical repair of hernia, and so far so good in allopathy medicine. There is no cure for hernia other than surgery. This has to be registered and made it very clear. Okay. And now, how do you approach for surgery? Usually it is a small incision in the inguinal region, that is in your groin, which usually goes in your boxer line. It is not seen on the naked eyes. So usually this was approached for very long time. Very safe surgery, very quickly done surgery. It is done in like less than 20 minutes, 20 to 30 minutes. So the other modality is laparoscopic surgery. With the advent of laparoscope and advanced laparoscopic training, now hernia surgery has routinely become a laparoscopic surgery. So you have options of both open surgery and laparoscopic surgery, and both are equally safe, both have equal benefits, both have equal disadvantages and advantages. Disadvantages very minimal. In open surgery, you will just have a scar, but in males, it would go inside your undergarment line. It is not seen to the naked eyes. And the second thing is laparoscopy. Yes, you will not have the scar. The recovery period is soon and cosmetically more accepted. Though the surgeries are not that major surgery, considered that major surgery, but still you need to be admitted at least as a daycare procedure, and anesthesia, either general or spinal anesthesia, is necessary. So the crux of the whole story is hernia is very common in males worldwide. Around 15% of males have hernia. In case if it is in your children, young adults, please come to the hospital, get yourself operated. Don't take second opinions about how not to get operated and get hernia treated. And if it is old age, please get them, because we need to see whether they need surgery, they don't need the surgery. Let us decide and then give you the best care. So with this, I conclude my talk. In case there are any doubts, we are very happy to clear your doubts at our hospital, Jaydeva Memorial, Rashtrottana Hospital, RR Nagar. So feel free to come see us on hernia clinic that happens on every Friday and Saturday between 9 to 5 p.m. in the evening. Thank you. Jai Hind.